folks, I'd like you to meet Gigi and tell you a story about Gaucher's disease. Gigi is a little girl. When she was 8 years old, her family found out she had a rare and little understood condition called Gaucher's disease. Gigi's story shows us that correct diagnosis and treatment of Gaucher's disease makes a big difference in quality of life and social integration. This is a story about a little girl named Gigi who lives in a small town in the countryside of Brazil. Gigi loves to play and to go to school. She loves her family and they love her very much. Gigi has always been a cheerful and intelligent girl. Everybody likes to play with Gigi, but it was hard for her to play and run like other children. When she was almost 8 years old, Gigi started feeling frequent pains in her legs. She would quickly get tired when playing, and she was often sleepy. Gigi's mother soon noticed something was not right. Gigi was losing weight and wasn't growing as fast as the other children her age. Purple bruises were appearing all over her body. On her 8th birthday, the guests and relatives who came to her party also noticed something was different. Gigi's mother got very worried about her and took her to a pediatrician. The doctor said that Gigi looked too short and thin for her age. She was also pale and her spleen seemed too large. Blood tests showed she had anemia and not enough platelets. So the pediatrician decided to refer her to a specialist in blood disorders. She would need to travel to the capital to see the specialist. But as she was about to leave, Gigi got worse. Her legs hurt very much and were getting thinner each day, while her knees were swelling up. She was having nosebleed and her belly was growing round and hard. Because of all this pain and distress, Gigi was beginning to behave differently. She was no longer cheerful. She looked sad most of the time, and she was beginning to hide from her schoolmates because they were making fun of her large belly. She was also afraid to lose balance and fall while running, jumping, or just playing. The specialist Gigi was referred to, a hematologist, suspected she might have Gaucher's disease, but requested a lab test to make sure. The test would tell the doctor if Gigi had an enzyme deficiency typical of Gaucher's disease. The lab test was positive. The doctor said the disease could be controlled if Gigi started taking proper medicine. Eventually, Gigi would be able to go back to normal life without the signs and painful symptoms she had been suffering with. The doctor explained that Gaucher's disease is a rare genetic and hereditary disorder. Specific genes received from the mother and the father come together in the child, causing Gaucher's disease to manifest. Our body produces a kind of enzyme required to digest fat inside the cells. When the child has Gaucher's disease, there is a deficiency of this enzyme, and fat begins to build up inside the cell. It's as if the cell gets fat. These fat cells are a distinctive trait of Gaucher's disease. They make it difficult for the organs to work properly. Most of them end up in the spleen, the liver, and the bone marrow, but they can be found in many other parts of the body, such as the lungs, eyes, skin, kidneys, heart, and even in the nervous system, although this is rare. Some people suffer with many symptoms, others don't. Gaucher's disease may be discovered at any age. Children, adults, and older people may all be diagnosed with Gaucher's disease. Once Gigi's diagnosis was established, the doctor would need to calculate how much medicine to give her according to her age, weight, and overall condition. Medicine for Gaucher disease is given by infusion, at home or at the hospital, but it requires a medical prescription and the assistance of a nurse. When Gigi was going to receive her first dose of medicine, the nurse explained she would feel a little prick of the needle. The infusion helps the medicine circulate in the body and quickly reach the organs that most need it. Patients respond differently to treatment. Some patients improve faster than others. But if the medicine is to make the patients feel better and help them get back to the life they had before, treatment should not be interrupted. Improvement comes little by little as the treatment progresses. Today is Gigi's 10th birthday. She is very happy because her life is returning to normal.